The Food and Drug Administration has amended its recommendations on the COVID-19 vaccine on Tuesday. The FDA now says a single dose of the bivalent vaccine specific to the BA4 and BA5 strains of the Omicron variant is enough for most individuals. Going forward, the FDA announced all coronavirus vaccines administered to those 6 months and older would be the bivalent doses. The original form of the COVID-19 vaccines from Pfizer and Moderna are no longer authorized for use in the U.S., the agency said. Individuals who haven't gotten a bivalent shot yet or haven't gotten vaccinated at all are still eligible for a dose. Amongst those who've already received the bivalent dose, only people over the age of 65 are eligible for another. That has to come at least 4 months after.
So what they're saying is, if you've never gotten a shot at all, never gotten any vaccination, you're not going to do the thing so many people did with Pfizer or Moderna, where you get one shot and then another shot a month later. You're just going to get the bivalent. The bivalent is what they want you to get. So obviously, the original shots were tailored to a different strain of the COVID, the original strain. The bivalent is supposed to be more narrowly targeted for the Omicron strain, which emerged after Delta. Now, there have been questions about whether the bivalent booster actually outperformed the initial booster, because remember, there was in between original shots and bivalent, there was a booster, and people were wondering, well, why authorize the bivalent when if you look at the data, there wasn't the booster seemed to be doing fine, or there wasn't better outcomes for people who then went ahead and got the bivalent. Anyway, I understand why they would say if you've not been vaccinated at all, you might as well get the bivalent. Should be the one you get because it's the one tailored to the strain specifically.
Right, but we're not in Omicron territory anymore. The current dominant variant nationwide is XBB 1.5, with 87.9% of cases being in that variant, while XBB 1.91 is another 4.6% of cases. This doctor is saying from this article in Nebraska medical outlet, the original Omicron variant is gone now. Currently, subvariants of Omicron are circulating, including XBB 1.5,
they don't have one
BQ,
yet
and others.
That's targeted to those variants.
Right. So, but again, the question of, if you were someone who got the 2 doses and then the booster, is it now the case that it's recommended to you to go ahead and get the bivalent? And if so, why? Is it because there is a perception or some evidence that the original booster has now lost its efficacy because the bivalent vaccine provides you more or different kinds of protection?
That is the recommendation coming from health people.
Yeah.
I'm not seeing any evidence that they're basing that on. It seems more like a hunch or a guess because, again, that's not what the data really suggested. Yeah, no,
the idea that it simplifies the process to have people know that there isn't this sequence of things that has to be done, one shot, then the follow-up shot, then the booster, this distinguishing between boosters and the initial shots. If everything just comes down to you get bivalent boosters, that can be your first thing, is the so-called booster. It's just one shot, and it can be administered on a semi-regular basis in the way the flu shot is administered without worrying about where you are in your vaccination sequence.
Right.
That obviously is
the flu shot does alternate. My understanding is that there are 2 at least main strains of the flu, and which flu vaccine they distribute in any given year, they basically alternate them, trying to anticipate what kind of outbreak of flu there will be that year. And so then that's the one they deploy. And obviously it works kind of okay. People get it, and then they get the flu. But just as is the case with COVID, as it turns out.
Yeah, I mean, this is such a strange time we're living in. Obviously, Joe Biden just ended the COVID emergency. There were implications for social safety net programs that have been extended under COVID. 15 million people threatened with being kicked off Medicaid, et cetera. But despite, the COVID being over proclamations, it's amazing how much coverage of COVID is affecting the public perception of how much exigency there really is. There has been somewhat of an uptick in infections, and in many places, infection rates are at levels where in an earlier time in the pandemic, there would have been a lot more alarm bells going off about what our behavior should be and what the public response should be.
Well, the lethality has gone way down.
Right. And
way, way, way down.
But the push and pull of that, I mean, the lethality has been down since the vaccines and the boosters have been out.
Yeah, I was ready to and those restrictions then,
and
if not before.
Whatever you think about it, one way or the other, whether you think that the media is failing in its responsibilities in covering COVID and it is more exigent now, or whether it was too alarmist before, the gap between our realities that the media has created, despite some similarities and what is actually happening on the ground, is unnerving.
Well, and here's a question I have, because a little bit this whole, you just got to have the bivalent, don't worry about anything else, does seem to contradict, or I think it contradicts, a notion that many health officials seem to have acknowledged or be suggesting that it does matter, that we're counting shots at some point. You've had 2 shots, and and how many infections, and given the importance of natural immunity, that should count like 1 shot. So if you've had COVID once, if you've had COVID twice, count that in your tally for how protected you are. Now it seems like they're not saying, and I think health officials, not just conservatives or critics of vaccination, health officials have eventually conceded that is kind of how it works. That if you've just recovered from COVID, you have that kind of protection, not a perfect protection, but some degree of protection, just like if you've gotten a vaccine shot, maybe more, in fact. But now they're saying, we're undoing that. We're saying, no, it really just matters if you have the bivalent. Because we're not going to, if you've never been vaccinated, let's say you've never been vaccinated, you've never had COVID, that's a very small number of people, globally, to be clear. But they'd now be saying, just get the bivalent, not the series of shots. So that would seem to me, do you know what I'm saying? Getting at? Isn't that kind of different than what they were saying before?
Well, I thought that was the whole purpose of the bivalent, that it does double duty.
That I don't know. Where's the evidence of that?
It doesn't answer your question about the role that natural immunity plays and when people are recommended to actually get the bivalent booster. As someone who was on the first round of the shot booster, I am confused by it, and I to your point, would like to see some concrete evidence-based information about what we know now about how long that last booster dose offers protection, how long natural immunity lasts.
I've had 3 shots and COVID twice. I had the 2 initial shots and the bivalent and 2 rounds of COVID. So
you're safe. You're wrapped in a suit.
Am I more protected than you had 2 shots of booster and 1 COVID?
And 1 booster COVID. Yeah.
So that's only 4.
Yeah, you are impenetrable, my friend. COVID can't get to you.
Yeah, we both know that's not the case at all. According to, what do you call me, Typhoid Robby?
Yes, I do.
According to a report from the Daily Caller, Republican Kentucky Congressman Thomas Massie sent letters to senior FDA vaccine officials on Monday, letting them know that the House Judiciary Committee will be investigating allegations that the Biden administration interfered in the agency's authorization and licensure of the COVID-19 vaccines. The Daily Caller first obtained letters to former FDA officials, Drs. Marion Gruber and Philip Krause, who both resigned following President Joe Biden's announcement calling for adults to receive a COVID-19 booster shot in August 2021, which Massie says put undue pressure on FDA health officials too quickly to authorize the vaccines.
Yeah, I think that it is frustrating that this is an ongoing debate. It seems clear at this point to most people, I think, who are consuming either conservative alternative media, that there were mistakes that were made in terms of the rollout of these vaccines. Now, whether or not it amounts to the kind of level of kind of conspiracy and long-term distrust that is being bred in certain parts of the media, I'm not sure about that. But I do think that some more accountability and transparency from the Biden administration would go a long way to preventing mix-ups, mistakes, errors, whatever you want to call them like this, from having a longer tail in terms of misinformation or a failure to ignore what is at this point more sound public health advice.
And do otherwise healthy young people who have had COVID and some number of shots, but not the bivalent shot, do they really need to get the bivalent shot as they're required to do so at college campuses all around the country, where administrators are saying you cannot return to campus this fall unless you've had the bivalent shot. Doesn't matter how many other shots you've had. Doesn't matter if you've had COVID before. You are a health risk, they're saying, even though we all know this is not doing anything to stop the spread. This is about your own health. It's crazy to me, but this is what my own university, the University of Michigan, is doing, and lots of other schools. Which seems totally crazy.
I will say,
indefensible.
I think in a world of perfect information, I agree with you. The only caveat I would add is that people aren't always good assessors of when they are healthy and young. There are a lot of comorbidities, complicating factors that many young people have. And I would be a little concerned. I can see an argument that not relying on individual self-assessment of whether or not they are actually at risk from some of the poor outcomes of COVID might in some cases be advisable. At very least, I think there needs to be more clarity promulgated to say, okay, I know that you're young and you think you're generally healthy, but a lot of young people are, let's say, in a weight range that is not obese or really abnormal in America, but might put them at risk, might have various other conditions, whether it's respiratory ailments, asthma. Everyone's huffing and puffing around DC right now because of the way allergies are acting up. You know, people have other things going on.
Yeah,
so that's my only caveat.
It might be advisable, but I got it.
Yeah.
But I don't at all think it should be required, even in the if it's required at a public university, that's pretty decisively required. So I don't approve of that at all. More Rising after this.